health service here in Tower Hamlets is absolutely excellent. I have no complaints at all about it. And I'm a member of the patients' doctors group up at our surgery, Chris Street. And I find it's just wonderful what they're doing.
I was diagnosed at 17, 18. My dad took me to sort of witch doctors and all that first of all. And then we went to a psychologist. She referred me, she told me that was private. She referred me to a psychiatrist, private, and then they referred me to Tower Hamlets.
ওখান থেকে আমি অনেক আগ থেকেই তার এখানে ওষুধ খাইতেছি, আমার মনে হচ্ছে যে না আমার ওষুধ কাজ করতেছে না, শরীর ভালো হইতেছে না, এরকম মনে হইতেছে। তো এইসব এরপরে দিয়া এরপর ডাক্তারে অনেক টাইম আমার লেগা বাংলাতে ইন্টারভিউটা নিয়ে আসছি আমার কি প্রবলেম আছে। তারা রিয়েলি মেডিকেল সাইড তো মানুষের অবশ্যই সব কথা না বুঝলে বোঝা যায় না, সব কথা যদি কেউ বুঝে না, ডাক্তার রোগীর সব কি বলতে চায় একজনের না বুঝলেই তা চিকিৎসা করা যায় না।
متعرفت على هذا الاوفيس على هذا الكوميونتي من طريق انا قاعد بالجي بي وان اوفيسر ان هير، واحده من هذا الاوفيس اجى للجي بي وقالت لي احنا كوميونتي اوبشن ونقدر نساعد المرضى ونقدر نرتب المواعيد وتتفضل يمنا، واخذ تليفوني وانا جد لي جاي حسب هذا البنيه اللي ما اعرف اسمها شو اسمها ما اعرف فرقت
আমার হেলথ সেন্টার আমি অন্য আসলাম, আমার এক বোন গেছেন অ্যাডভাইস দিয়েছেন আর অ্যাডভাইস হয়েছেন আর কি কমিউনিটি অপশন টিপ সার্ভিস বালা আমার সাহায্য করবা আর সাহায্য করবা হয়েছেন করার বাদে আমি তাই আমার ফর্ম দিয়েছেন, ফর্ম ফিল আপ করছি, আমার নাম অ্যাড্রেস সবটা নিয়েছেন লিখে।
Waiting times at hospitals, I'd like them reduced. The appointment systems have improved better over the years, but I'd like it a little bit more. Personally, I think they should be a little bit more easier, so that you don't have to book an appointment when you're ill. You can I need an appointment today, rather than, can you come back in next week? Some places you have to book surgery. I have personal experience. You have to book 3 or 4 months in advance. 2 or 3 weeks in advance. And with hospital appointments, like I'm under the hospital myself, and I have to wait 2 or 3 months to be seen by a doctor.
Nick has a complex range of medical issues that have developed over the last 8 years or so. From a physical perspective, she has what's known as polyarthritis, which is principally psoriatic arthritis, but then rheumatoid, osteoarthritis, and spondylitis. On top of that, she has medication-induced tremors, which are getting quite pronounced. Type 2 bipolar, depression, agoraphobia, panic attacks and anxiety attacks. The result of this now is that she has a dependence on medication.
I've been in psychiatric hospital 10 times. I've been sectioned twice. I was last October for 4 weeks. My psychological health at present, I'm a bit up and down. I see a psychologist at Stepney and Wapping Community Mental Health Team, because sometimes you can feel really low, and sometimes you don't know why and things like that. You know, that's definitely a difficult thing to deal with, or being manic.
I cut my finger while I was cleaning the fridge, silly, and it was pouring of blood. I went to A&E department. When they asked me, where's the emergency? I said, no, I cut my finger, but they were accident. They didn't say that you shouldn't come. They treated me immediately. They didn't manage to glue it because it's a fingertip, and they have it bandage and pressure bandage. And no, I was treated with dignity and respect. I got, no qualms. I think they are very, very good. But maybe from hindsight, I think people like me shouldn't be going A&E unnecessary. I think we should be cautious because there are people for emergency.
I think the government needs to continue funding the NHS, putting money where there's greater need, like reducing waiting time, putting money where there's a high demand, like hip replacements for the elderly. I mean, they need to put some money where the elderly needs it more, because these are the people who have been putting so much money into the NHS through the National Insurance contribution, and I think it should be fair for them to be a recipient.
I think I would like to see a system which is much more flexible when it comes to gaining access to the different community health services. Once you get the service, whether we're talking about audiology or district nurses or continence services, the services are very good, but getting to them in the first place is a real obstacle course, and I think there needs to be a much better telephone service and means of responding to people when they get in touch with you.
Perhaps there's opportunity to develop the skills of frontline staff such as GPs, receptionists, and develop and train them so they can signpost people better to existing services. And yes, there is a role there and an opportunity to improve access for patients. We need, and I do use the word we, to move away from, it's just the role and the receptionist and they have a very specific prescribed role. It really is patient customer service.